All right, today we're going to talk about something you've probably heard of, maybe you've even felt it, but you might not fully get what's going on. We're talking about hypoglycemia, or low blood sugar, and you'll see it's a whole lot more common and way more complex than most of us think.
You know exactly what I'm talking about, right? That sudden moment where you feel shaky, maybe a little dizzy, you get anxious, or you just can't think straight. It hits you out of nowhere. We all call it a sugar crash. But what if it's not just a feeling that passes?
Because this is where we need to dig in. We're going to explore how that crash can actually be a serious medical alarm bell. And for millions of people, the thing that's setting it off is hiding in plain sight, right inside their medicine cabinet.
So just to make sure we're all on the same page, hypoglycemia is just the medical term for when your blood sugar, your glucose, drops below a healthy level. Now, think of glucose as the main fuel for your brain. So when you start running low, your body, well, it freaks out a little and sounds an alarm.
And here is the magic number you need to remember: 70. A blood glucose level below 70 milligrams per deciliter is pretty much the official alert. That's the point where your body starts screaming, "Hey, I need fuel right now." Keep that number in your head as we go.
Okay, so let's start with the basics. Why does this even happen? And more importantly, who's actually at risk? The answer you'll see is probably not who you think.
Now, I know when we hear low blood sugar, we immediately think of diabetes. But check this out. For adults, medication is one of the biggest causes. In fact, right after alcohol, it's the most common trigger. So this isn't some niche problem. It's a really broad public health issue.
And that brings us right to the heart of what we're talking about today. Let's really pull back the curtain on the specific medications that can cause your blood sugar to take a nosedive.
No surprise here, the main offenders are drugs designed to lower blood sugar for people with diabetes. But pay close attention to the two at the top, insulin and sulfonylureas. These two are the heavy hitters. They carry the highest risk of causing hypoglycemia all by themselves. The others on the list, they usually become a problem when they're mixed with other drugs.
So, what are these drugs actually doing to make your sugar drop? Well, they have a few different tricks. Some of them basically push your pancreas to pump out way more insulin than you need. Others mess with your body's cleanup crew, so insulin hangs around for too long. Some can even block your body from making its own glucose. But no matter how it happens, the result is the same: not enough fuel in your system.
But, and this is so important, it is not just about diabetes drugs. Just look at this list. We're talking about beta blockers for your heart, common antibiotics, even some antidepressants, and big doses of NSAIDs. All of these can trigger low blood sugar, especially in people who might already be vulnerable. And beta blockers, wow, they are uniquely dangerous here. They can actually hide the warning signs. You see, things like a racing heart or shaking hands, that's your body's adrenaline kicking in to say, hey, we've got a problem. But beta blockers are designed to block adrenaline, so all those alarms get silenced. A person might have no idea their sugar is dangerously low until it's really, really serious. Sometimes sweating is literally the only clue they have left.
So, that leads us right into the symptoms. Knowing what to look for is absolutely your first line of defense. Your body's alarm system kind of works in two stages. First up are what they call adrenergic symptoms. That's the adrenaline-fueled stuff, the shaking, the sweating, the pounding heart. But if you don't treat the low, you move into the neuroglycopenic symptoms. That's a fancy way of saying your brain isn't getting enough fuel. And that's when you see confusion, weakness, dizziness, a clear sign that things are getting worse.
And here's what's truly terrifying. For some people, especially if they have low blood sugar a lot, that first alarm system can just give up. It stops working. It's a condition called hypoglycemia unawareness, and it means a person can drift into a severe low without any of those early warnings at all.
So to make this all a bit clearer, experts break it down into 3 levels. Level 1 is the alert level. Think of it as a yellow light. Your glucose has just dipped below 70. You're probably feeling those early adrenaline-type symptoms. This is your body telling you, hey, it's time to act. Now we're at level 2, clinically significant. This is the orange light. Your glucose is now below 54. At this stage, those brain-related symptoms can start to kick in. Your thinking gets fuzzy, and it might even be hard to treat yourself. This is a big deal.
And then there's level 3. This is severe. This is the red light. And what's interesting here is that it's not defined by a specific number. Level 3 is defined by the person's condition. They are so confused or so physically weak that they cannot help themselves. They need someone else to step in. This is a full-blown medical emergency. You know, a single episode of low blood sugar is scary enough, but when it's severe or it happens over and over, the risks go way beyond that temporary crash feeling.
The immediate dangers are pretty clear, right? Your thinking is impaired, which could lead to a car crash. It can cause serious falls and injuries, but it can also trigger dangerous heart rhythms, seizures, and in the worst-case scenarios, a coma or even permanent brain damage. This is exactly why we have to take this so seriously.
And then there's the damage you can't see. There's something called fear of hypoglycemia, and it is a heavy, heavy psychological weight. It can make people terrified to exercise or to even go out with friends. It disrupts sleep, puts a strain on relationships. It's this constant humming anxiety in the background of your life.
Okay, we've talked about the problem, we understand the risks. So now let's get to the good stuff. The solutions. This is your clear, actionable playbook for exactly what to do when low blood sugar happens. For level 1 or 2 low, the go-to is the rule of 15. It's super simple and it works. First, you eat or drink 15 grams of something sugary that acts fast. Think 4 glucose tablets or half a cup of juice. Then, and this is key, you wait 15 minutes. Don't eat anything else, just wait. After those 15 minutes are up, check your sugar again. If it's still low, you just repeat the whole process. This is great because it keeps you from overdoing it and sending your sugar sky high.
But for a level 3 emergency, the rules are different because that person can't help themselves. If they're awake and can swallow, you can give them a little more carbs, maybe 20 grams. But, and listen closely, if they are unconscious or can't swallow, do not try to force food or drink into their mouth. That's when you need glucagon. It's a rescue medication, it comes as an easy-to-use nasal spray or an injection, and you always call 911.
So let's wrap it up with this. Knowing how to spot and treat low blood sugar isn't just useful information, it can literally save a life. You have the playbook now, but what about the people around you? Your family, your friends, your coworkers? Do they know what to do? Taking just a few minutes to share this with them, that could be the most important thing you do all day.